Hey guys, so please excuse the hair. It started out looking really nice this morning, and as the day has gone on, it's just a mess. So this video is addressing what is it like to be a dietetic student and what is it like to be a dietetic intern. So let's start out being a student first. There's a lot of science. I think a lot of people underestimate the amount of science that you have to take to be an RD. I think a lot of people underestimate the amount of education it takes to be a registered dietitian. Now, in my What is an RD video, which will be linked in one of these corners in the little eye, I addressed that dietitians must know all of the same conditions that doctors do and how they affect the body. Our bodies are made up of food and water, and dietitians specialize in food and water. So we have to know all of the conditions, how they affect nutritional status, how nutrition affects the status of the condition, and all of that. So there's a lot of science involved. There's way more science involved in dietetics than there is in nursing. There's quite a bit more than in OT. It's about on par with PT. Obviously, MDs, NDs, all of ODs or DOs, all of those medical doctor titles, they involve more science, but there's a lot of the same foundational science going on. So there's biology, microbiology, biochemistry, chemistry, organic chemistry, anatomy, physiology, there's a little bit of pathophysiology. There's a lot of science, there's a lot of body systems, there's a lot of living science, there's a lot of chemistry, there's quite a bit of math even. And in order to understand a lot of the chemistry, you need to know a lot of math. And that same math is involved in a lot of the calculations that we do as RDs. There is quite a bit of math. A lot of it is fairly simple math, but you still need to have a good proficient use of numbers. So those are the basics. Those are like the prerequisites that you would need in order to be successful going into a dietetic program. In my previous video, I talked about the different avenues that you can take in education to become an RD. But here I want to talk about when you're actually in that program, when you are in the meat of the program, and you are taking, nutrient related classes, nutrition, education, counseling, MNT, medical nutrition therapy courses, all of that. So I am sort of in that transition phase between a lot of the hypothetical counseling and nutritional biochemistry and all of that courses. So I'm transitioning from a lot of background knowledge into practical application. So that is where being an intern gets involved. So we are learning about the specific conditions and specifically how nutrients interact with those conditions and how conditions are affected by the nutrition that you take in. So it's a lot to know. It's a lot of memorization. It's a lot of remembering back to your physiology and anatomy classes and the processes that happen in the body that allow us to be healthy individuals, that allow homeostasis to happen, that allow us to be in that great, dynamic homeostatic place, and how the fluid that we take in, how the protein, how the carbs, how the fat interact, how all of your micronutrients, your vitamins, and your minerals interact and help your body undergo enzymatic reactions, how cells and DNA are affected by nutrition. There's a whole segment of dietetics that is called nutritional genomics, which is the nutrient effect on the genome and the genome effect on how our body utilizes nutrients. So you can get as scientific, as laboratory based as you want in this field. Don't think it's just counseling. Don't think it's just working in a hospital. There's so many ways to go with this degree. There's a lot of management involved in this degree. There's a lot of food service involved in this degree. And one of the things that I've heard from other students, and one of the things that I feel myself, is that this degree, this dietetics degree, is much more diverse than we ever thought it would be. There's a lot more science, there's a lot more food service than we would have thought previously. That's not a bad thing. It allows you with this one degree to have an expertise in many fields, um, including the traditional counseling and education that you would think of with a dietetics degree. But there's so much management involved, and there's so much food service, and there's so much community involvement. There's a lot of community service. So when we talk about dietetic internships, and there's those three areas, the food service, the community, and the clinical nutrition, those are really three separate mini degrees that you're getting within this one degree. So you may end up taking classes and being in internships that you don't necessarily love, but they're going to give you that expertise. They're going to give you that experience that allows you to be a very versatile employee to someone later on. So being a dietetic intern and being a dietetic student isn't always peachy, and it's not always interviewing clients, and it's not always giving diet advice. A lot of it is listening, most of it is listening, and a lot of it is preparing food, sharing experiences, just being available. That's a lot of it, and being really supportive. That's the crux of being a dietitian and being a dietetic student and being a dietetic intern. You want to listen, you want to be supportive, and you want to share your knowledge, your expertise, and your experience. So that's a lot of it. That's a lot of what we do. Um, so far, I can really only speak to the clinical dietetic internship experience. Being in a hospital is at once terrifying, amazing, and exhausting. Those are three words that I would use to describe it. It's exhausting because you're using your brain all the time. There's no downtime. There's no, let me just go sit down over here and blank my mind and do some data entry. It's not really like that. There's a little bit of, just data entry, mindless stuff, but you're still thinking. You're still thinking through those numbers that you're putting in the chart. You're still thinking through that patient interview that you just conducted. You're always learning. There's always a new experience, especially as you first start out. It's really intimidating because you have all these doctors and these nurses who seem to know what they're talking about, and usually they do, and they don't, you know, I don't know how to put this delicately, but there's not a lot of respect for dietitians, and that extends obviously to dietetic interns. We are students of a profession that there isn't a lot of respect for. And frankly, there should be because there's a lot of education, knowledge, and expertise that go into this field. But that's another story. It's scary, and at once, once you get there, you really want to be in the mindset of just soaking it all in. Take everything in. Be super observant because you're going to learn not only from your patients, which you do, you learn a lot from your patients, and you learn a lot about what to expect from future patients. You learn from your preceptor, but you also learn from the nurses that you work with, and you do work with the nurses pretty closely. You can learn from the doctors. You can observe rounds, and you can listen to the doctors talk about these specific conditions. You can, be in the room when they're having interprofessional healthcare team meetings, and you can hear from the speech language pathologist. You can hear from the nurses. You can hear from PT, OT, the doctors, and you can hear them talk in their medical terminology, but you can also hear them on rounds, talk to the patients, see what kind of language they use, see how the patients respond to that. It can really help you with your bedside manner, your educational style, and just be more proficient in that language that you speak in the hospital, that medical terminology. It's really important. And it's terrifying too, because you're like, what if I can't soak it all in? What if someone, asks me a question I can't answer it? And those things run through your head, but at the same time, know that there's people to fall back on. You are a student and you aren't expected to know everything. So don't go into a room, pretend like you know the answer, make something up, or dismiss a question or ignore a question because you can find the answer. You just have to be resourceful. So that's a lot of it. It's really rewarding. It's sort of depressing too. You will find that a lot of patients, they don't want to listen to you, and it could be that ignorance and respect thing where they don't know who you are, they don't know what you do. Sometimes if you give a little introduction of yourself and what the field is, they might be a little bit more receptive, but oftentimes patients just don't want to hear it. You know, they're chronically ill. Maybe they're in pain, maybe they're nauseous, they don't want to talk about food. You know, that's completely understandable, and you can always go back and try again later. If they're still in the hospital on the next day of your internship, go back and check on them. There's nothing saying that you can't do that. There's nothing saying that every day you have to see new patients and only new patients. You can go back, you can check on them, you can learn from that repeat experience. Um, what else? You know, sometimes patients, you know, I had a woman the other day with diabetes, uncontrolled. You know, she had infected ulcers on her legs, she had necrosis going on, and she did not want to hear about consistent carbs. She didn't want to hear about carb counting. You know, I asked her a few questions after she said she didn't want any education to try and stimulate some conversation without pushing too hard. And she just told me, you know, I've had diabetes for years and I know what a carb is and all of this. And I was just like, okay, you know, and I asked a few more questions about her numbers, if she knows her numbers, if she knows what they should be. And she did. She knew what her numbers should be. She didn't really know what her numbers were, but you know, she was answering my questions, but she just kept saying, "No, I don't want to hear anything about it. No, I don't want your handouts. No, I don't want anything else." And you know, "No, I don't want you to go through the menu with me. No, I don't want this. No, I don't want that." And it's sad because you know, that's the crux of our job within a hospital is to see these patients who are in, you know, unfortunate circumstances and to try and offer them a hand to let them know that there are more people that are supporting them, to give them education on how they can help themselves once they get home too, once they're out of the hospital. And when they don't want to hear it, it's a little bit discouraging because this is what we do, this is our expertise, and it's just rather unfortunate. But you have to remember that for every patient that doesn't want to hear you, there is one that does. And don't dismiss them either, because just because they're in pain and they don't seem to want to talk doesn't mean that if you come back in a little bit, they don't. And maybe they don't want to talk, but they will listen. And they're willing to that, you know, to do that. So you just have to keep asking questions and just, you know, be open to what they want and what they want to do. And don't take it personally if people don't want to talk to you, because that's something that I've had a hard time with. You know, I go into these patient rooms and I know what it's like to be on the other side of it. I know what it's like to be that patient and have people coming into your room at all hours and interrupting your relaxation or your sleep or whatever. And you're in pain and you don't want to hear it. You don't want anyone to ask you any more questions. So I know what it's like. And I go into those rooms and I'm like hesitant to ask these questions, especially if I see pain or I see exhaustion or I see confusion. I feel bad about it. I feel bad about going in there and talking to them and asking questions. But you can't do that because if you get in there and you get a patient who's receptive, you just want to make sure that you are there for them and that you are there wholeheartedly and that you don't feel nervous or bad about being in there because this is your job, this is your area of expertise, and you are there to help them. So that's my spiel, that's my shtick. If you have any other specific questions about being a student, being an intern, again, I don't have a whole lot of experience in it yet, but this is what I found so far. So if you have any questions, please link them below. I will be linking in whichever corner the little eyeball is in my previous RD videos. I also make videos on Crohn's, medications, diets, foods. There's a whole plethora of different things that I've made videos on this channel. So if you're interested, please like, share, and subscribe. I will keep bringing you videos if you want to watch them. Even if you don't want to watch them, I'm going to keep making them because they help me practice. So thank you guys for watching if you made it to the end. Happy applause because this is turning out to be a much longer video than I anticipated. And yeah, let me know if you have any questions and I will do my best to answer them. So I'll see you guys in the next video. Thanks for watching.